Many times when students come to the School of Pharmacy, they have an idea of what it's like to help people. And they have helping hearts. That's why they want to become a pharmacist, because they want to help someone. And they want to do it through science. And so what community outreach does is connects the dots of the science with the empathy with the patient in a low-stakes environment where they're supervised by faculty.
South University emphasizes community outreach because it is central to our mission. It gives our students the opportunity to apply the knowledge they've gained in class to solve real-world problems while also making a positive impact in the lives of individuals in the community. Not only does it benefit our students by improving their communication skills, giving them a sense of purpose, but it also helps us to address health disparities in the community.
There are benefits for many individuals when our students participate in community outreach. The service to the community is creating an environment where they have access to a student pharmacist to ask about drugs that they may have to take, their pharmacotherapy, access to free blood pressure screening, blood sugar screening, in addition to patient education. For the student pharmacist, it's really about learning to interact with the public and learning to serve, to make them practice ready, ready to serve the community, ready to serve their patients, because ultimately they are our clients. What goes back to developing practice-ready pharmacists. When you think about a practice-ready pharmacist, you're not just talking about the science. You're talking about the interpersonal skills of a pharmacist. You need someone that's going to be empathetic. You need somebody that's going to be a good listener. You need somebody that cares about their community and the people they serve. What you want to do is learn how to establish rapport. How do you make sure that your patient understands that you care about them?
I know sometimes people think community outreach always involves going out in the community, but there's a lot that we actually do on campus.
Dr. Kusha and I are the faculty advisors for the Multicultural Pharmacy Student Organization. Our most recent fundraiser will be a pop-up thrift store where we are reselling women's clothing to raise money for cholesterol and A1C strips. We are going to use those test strips specifically at our health screenings. If and when we have items that are left, our goal is to donate them to the Union Mission to the Women's Shelter. So we're very excited about doing this. It's our first annual event.
We have a very diverse student and faculty, and we celebrate diversity.
We do our best to recruit individuals from different ethnic backgrounds, different racial backgrounds, different ages, different educational backgrounds.
Because it allows us to better address the unique needs of patients that we encounter in the community. What we stand for is a place where everybody is treated with respect, with dignity, and with love.